Thank you, everyone. Hi, I'm Bianca. I am a veterinarian. I am a boarded avian specialist. I work in multiple facets, but what's relevant here is I'm the medical director of Harrison Bird Foods, and I also own my own consultation service where I practice and work with veterinarians to help them advance their knowledge in just avian medicine in general. So thank you for having me. And the perspective that I bring to this conversation is a little bit different. So what we've heard about so far is, what are our parrots doing out in the wild? How can we support them at their early life stages? And what I want to talk to you guys about over the next 15 minutes is, what are we able to actually do in captivity? And I think that some of the conversation we have, that you've already heard is maybe bringing some things up, like how do I get my bird to be so active in captivity? How can we mimic the wild environment? Should we be mimicking the wild environment? And kind of go from there, right? So I think that the first thing we have to recognize is that we have essentially we have elite athletes. A young parrot in captivity has the potential of so much. And ultimately, we've forced these elite athletes into early retirement, but we keep them with the same metabolism and appetite that they were designed with. So, you think about what Dr. Brightsmith was talking about and how they're flying over 10 kilometers a day to forage, et cetera. Like, that's what these guys are built for. But I don't know about y'all, but my house is not 10 kilometers long? So there's definitely a discrepancy between what the wild offers and what captivity offers. Both offer very great things. So how can we merge the benefits of both? I think is the big question that we're always trying to answer. And this table on the side here just helps us understand, like, in the wild, you're foraging, but in captivity, we're just refilling that bowl, right? Miles of flight versus maybe minimal types of activity. I do want to recognize there are some birds that are out there that are free flying, et cetera, but even those birds are not touching the significant amount of flight time and activity time that their wild counterparts are. I think a really important thing is that, when you're looking in the wild, there is going to be certain aspects of seasonal scarcity. And in captivity, oftentimes, and this is what I see clinically, there is a constant abundance, right? And then again, just high energy burn versus sedentary lifestyles. And this is what we've learned so far. The wild diet is variable, it's demanding to obtain, it's earned. And the nutritional value of these wild accessible items, it really is going to vary by season. So if we were to take the wild diet and bring it into captivity, and people are trying to do this, right? Why is it not working out? Well, we've got a couple of different variables that we have to consider, and these are just some of many. Our wild diet plus hours of flight is what gives these birds out there balance. We can't mimic that exactly in captivity. And so the theory is, should we be mimicking that exactly? Or how can we pull the benefits of both? And then in captivity, birds are not expressing the same nutritional wisdom that in some instances folks are seeing out in the wild. So another really interesting thing, we have to have more control or provide a more controlled situation for a foundational diet in captivity to avoid excess or deficiency when it comes to nutrition. And when we see abnormalities in that nutritional balance or that foundational balance, we're seeing things like obesity, subsequent hepatic lipidosis, hypo or hypervitaminosis A. And then one of the things that's, at least for me in practice, is really devastating is the development of atherosclerosis. We can improve obesity, we can improve hepatic lipidosis. Atherosclerosis is one of those chronic degenerative disease processes that we can manage, but we can't reverse. Not yet, right? Wouldn't that be cool if we could for both, I think, humans and birds? So, because I come from a clinical perspective, I want to present this case to you guys. This is a really striking one that I think people don't really talk about so much. And if you're familiar with cockatiels, you're probably going to pick up on some of the physical or visible changes that this bird is displaying. So, Boomer is a 10-year-old DNA male cockatiel. He presented at a weight of 120 grams. And most cockatiels are going to hang out like in the 100 grams, maybe like 95 to 100. So we know that Boomer's carrying extra weight. What we don't know is it in the form of excess adipose, or is it because there's a tumor or fluid or something else? Interestingly, he also presented with, persistent increases in respiratory rate and effort, lethargy, and appetence. These are pretty nonspecific clinical signs. If you're looking at these pictures, you can see that there's this enhanced yellow coloration of areas that should totally be white. Even his crest and along the cheeks here are highlighter yellow. And you can also see that there is poor health of the keratin of his beak. And so, on his exam, I didn't feel any fluid, like anything palpably fluid wise. I saw that there was a lot of excess adipose externally, but that doesn't always explain why the respiratory abnormalities, the lethargy, the inappetence, that sort of thing is occurring. So we took radiographs, and this case is really cool. So some of you guys may or may not be familiar with what avian radiographs look like. So I did this. You can see that the pectoral muscles here on either side share a little bit of a whiter kind of appearance. And then the fat that we can see on the excess on the outside of this bird on physical exam is this section here, right? We can also see that the liver is enlarged and that as a result of that, there is a subsequent decrease in air sac space. That's what these kind of like H type things are looking at. If we look on the lateral projection, so this is the bird laying on their side, you go, whoa, where are your air sacs, dude? You can't find them at all. So this bird has a clear reduction in ventilatory capacity. The question is why, right? So the next step we took was doing an ultrasound. And ultrasound in birds can be very informative or it can be very frustrating. So you have to go into it with an open mind. But ultrasound is very good at identifying a couple of things. Fluid and also adipose is one of them. And on this bird's ultrasound, all we saw was just a whole bunch of intestines encased in what appeared to be adipose. So the working diagnosis for this bird was a reduction in ventilatory capacity, respiratory abnormalities secondary to that, all because he's got a whole bunch of fat that he's deposited inside. And what's really interesting is I think it was maybe like a couple of weeks ago or a month ago, there was a study that was published that shows that birds can sometimes put fat on the outside, but they also can put fat on the inside, and we don't necessarily see that. So this is really cool. Little Boomer and I went on a diet together. And what we can see is that from the time of presentation, over a year's time, we can see that the size of the liver has decreased. We can see that on the lateral projection here, that you're seeing more functional air sac space, and that is 100% correlated with a reduction in weight. Did this bird have to go through this? Not necessarily, right? If this bird's foundational um, nutrition was more appropriate, this would have never been a story that he had to have in his life. Was he able to make a full recovery? Absolutely. It took him a year. And even at a year, we still see that there's some excess adipose here on the left-hand side. And once you kind of manage the diet and see get your weight in a good place there, then you can start adding activity and exercise, etc. So Boomer's a really kind of interesting example of when the diet is unbalanced, when things go wrong, what can happen. So, what does a healthy captive diet look like right now? What we understand is that birds do well with about 80% of a formulated diet, well, whether that's pellets or nuggets is kind of up to y'all, up to your bird, right? But something that's formulated thoughtfully. And then the remainder of that kind of volume is vegetables, right? Um, We also want to make sure, so not only is the ratio important, but the volume of what you feed is important as well. These recommendations are based on weight of the bird and should be available on the back of the bag that you're using. So whatever food bag it is, you should see that volume. Okay, so this is one of my absolute soul patients. This is Stanley. When she presented to me, she was 29, 30 years old. And we had her in the hospital for a multitude of things, but Birdie Boot Camp was what we called this. She came in an absolute seafood junkie, and this is what she'd been eating her whole life. The reason why it became relevant is because she got older, she developed arthritis, and her mobility was very, very poor. So the excess weight that she was holding played a bigger role in her overall health, well-being, and ability to just her quality of life. So she went from eating these giant sprigs of millet, which she was very happy about, I think you guys can see, to being a little bit PO'd that she had to have her broccoli. But ultimately, it was a slow and careful process, a lot of positive reinforcement, a lot of mirroring and introduction of new foods, new veggies, things like that with her favorite staff member. She had one of my nurses that she absolutely loved. And we even were starting to introduce her to foraging, which you can see kind of like these cups in the background that we cut up and whatnot. So slow and steady introduction. Stanley wound up doing wonderful. We were able to wean her off a lot of the medications that she was on for her arthritis. And she lived a very happy life for about 10 more years until she succumbed to neoplasia and ultimately passed away. But just absolute wonderful girl. So, why do we look at the nuggets and pellets as the foundation? What it does for our birds is it gives them a controlled food item. Every bite is relatively the same. It's calorie controlled. We know how much calorie is in a certain volume, whether you measure that by grams, kilograms, or a tablespoon, right? It's built for the species or the animal class, not for the bird's preferences. So if there was a diet built for me, it'd be donuts, chocolate frosted donuts from Publix. That would be amazing. But that's not reality. That's not what's good for me. Our birds are going to be like me. They're going to want a donut, right? So we have to offer them something that is built to make sure they have a strong foundation. And then we also need to make sure that these diets that we offer, if it is a formulated one, is predictable over time. So we need to make sure that there's good quality control, both as the food is being developed and then also the post formulation evaluation of it. This information is either available on the back of the food bags that you guys have, or if you call the companies, everybody who does this stuff right will talk to you about it. And everyone is super nice because we all have the same goal. How can we care for our birds the best way possible? So, you've heard a couple of things about, evaluation for what is an appropriate nutritional balance for a parrot. And in the dog and cat world, AFCO, which is this large kind of credentialing association, creates these standards for feeding trials. And if a food is fed to either dog, cat, etc., then and it meets those standards for the feeding trials, then it is considered to be complete and balanced. Is it perfect? No, nothing's perfect in this world, but it's better than nothing. We have we have AFCO like guidelines for chickens, for poultry, but just as we've heard, the poultry like requirements are not necessarily applicable to to our parrots. So what do we do? This is the big question and what has created our formulated diets and what's advanced them over the years. It started, I don't know how many of you guys remember monkey biscuits, but it started with monkey biscuits, right? And then our veterinarians who are practicing 40 years ago were seeing, significant clinical presentations of vitamin deficiencies, nutrient deficiencies, all sorts of different things. And they said, hey, we got to do better. So they did better